Body composition is an important measurement for monitoring our health. Using a simple pair of calipers, you can measure your body composition to track your progress towards health. This may not be the most accurate method for measuring body composition, but it is a simple method that you can do at home by yourself. To get the most accurate reading for body composition using calipers, you would need the assistance of a professional. However, with practice, we can learn to perform this method well. To begin, we would need to take measurements of the skin fold at three separate sites. Typically, in men, these sites are the chest, the abdomen, and the thigh. In women, typically, these sites are the back of the arm, the hip bone, and the thigh. Now, for women, it may be difficult to measure the back of the arm without the help of someone else. So, if you are by yourself, you can try measuring the chest when possible or the side of the chest under the armpit. The important thing is consistency. It is true that the equations that we use for these calculations were designed for those specific points that I mentioned, those specific sites. But we're interested in an estimate that we can follow over time to monitor our progress. You can even just measure the thickness of the skin fold at these three sites and monitor that to track your progress. The chest reading is taken halfway down the line, joining the shoulder to the nipple. The abdominal reading is taken to the right of the navel, about 1 inch from the navel. The thigh reading is taken halfway down the line, joining the leg crease to the kneecap. The chest wall reading is taken on the line joining the armpit to the leg, about midway down the chest wall. And the hip reading is taken directly above the hip bone. At each of these sites, pinch the skin and pull it away from the underlying muscle to form a fold. The fold should contain only skin and fat. It should not contain muscle. Take the calipers and align them so that they are perpendicular. The prongs of the calipers should be perpendicular to the fold in the skin. Connect the calipers to the skin about 1/4 inch from your thumb and index finger and compress the calipers until you hear a click. At that point, you should read the thickness of the skin in millimeters and write the value down in a notebook. I like to place an X at the point with a non toxic pen so that I can consistently measure at the same location as I will be taking multiple readings at each site. Repeat this process 2 more times to get a total of 3 readings. Then add the 3 values of skin thickness that you receive and divide by 3 to get an average reading. Always try to use the same side of the body, usually the right side, for consistency. You can then input these values into an online calculator, which will then give you your body fat percentage. I've provided a link in the description to a calculator and a table that will provide these values as well as indicate ideal and poor values for body fat percentages. Our bodies need fat to work properly, but too much fat can cause heart disease and strokes, and diabetes, and joint diseases, and certain types of cancer. Although there are many more accurate methods for calculating body composition, this is a simple method that you can do at home. Monitor your body composition to maintain good health. Until the next video, stay healthy and stay safe.